We're here today at Advocate Christ Medical Center, and I'm sitting next to our external enhanced counter pulsation table, which is the therapy that we have offered here at the medical center for over a decade. What basically happens is the heart squeezes or pumps during one half of the cardiac cycle, and that pumps the blood to the rest of the body. And during the other half, it relaxes, fills up with blood for the next cycle. But most importantly, it's during that period that the heart gets its own blood supply back to the heart and gets the oxygen it needs to continue to do the work of pumping. The way EECP works, therefore, is these cuffs, which go around the legs, there's 3 of them, inflate and deflate with the cardiac cycle. So they inflate when the heart is at rest, forcing blood to go back into the arteries that feed blood and oxygen to the heart, and then rapidly deflate when the heart goes to pump, allowing there to be less resistance for the blood to leave the heart and more efficiently gets to the rest of the body. That has in turn led to less work that the heart has to do. And there have been a lot of trials done, particularly ones that we've been involved with, showing that patients who have angina or chest pain that isn't controlled with regular medicines is more effectively controlled with the EECP. The things that we have noticed is that these patients have longer exercise capacities, have less episodes of chest pain, take less amount of nitroglycerin, and overall feel better. The important thing is that the effect of the treatment, which is 35 treatments for 1 hour each over a period of 7 weeks, may last not just a week or 2 or a year, but we see it way out beyond 3 to 5 years. So people have a sustained improvement in how they feel.
Where I was having angina almost every day, and sometimes I was having it 3 or 4 times a day, and most generally I could keep it under control by just resting. Sometimes I would have to take my nitroglycerin. Other times I would be going to the hospital 2 or 3 times during the year. And the doctors were getting a little tired of seeing me, but they were very patient with me, and they continued to work with me. And finally, my primary cardiologist, Dr. McCriskin, said, let's try something new, and that was in June of this year. And he said, let's try the EECP with Dr. Silver. I could tell a difference within the first week that it was helping me. And when I first came, there's an incline coming into the hospital here. I couldn't climb that incline without huffing and puffing because I was short of breath. And after the first week, I could walk that incline without being short of breath. So to me, that was an improvement. The last 2 years of my life had been where if I didn't lay down and rest every day, it was a rarity. Some days I didn't get out of bed. So my quality of life was not very good, let's put it that way. So with the EECP, it was allowing me to have that quality of life come back for me.